Have you ever wondered what happens after a medical procedure, especially one that sounds a bit intimidating? It is completely normal to have questions about recovery, wanting to know what to expect and how long it might take to feel like yourself again. For most people, the immediate recovery time after a lumbar puncture, often called a spinal tap, is relatively quick, usually just a few hours. However, a full return to all normal activities might take anywhere from 24 to 48 hours, with the main concern being a potential headache. A lumbar puncture involves carefully inserting a thin needle into the lower back to collect a small sample of cerebrospinal fluid, also known as CSF. This fluid surrounds your brain and spinal cord, acting as a cushion. The primary reason for recovery time is to allow the tiny opening in the dura, the tough membrane covering your spinal cord, to seal. This sealing prevents leakage of the cerebrospinal fluid, which can cause a post-lumbar puncture headache, the most common side effect. Staying still for a short period after the procedure helps this natural sealing process. During your recovery, it is usually recommended to lie flat for 1 to 2 hours immediately after the procedure. This helps reduce the risk of a headache. You should also drink plenty of fluids, such as water or caffeinated beverages, as this can help your body replenish the cerebrospinal fluid more quickly. Avoid strenuous activities, heavy lifting, and intense exercise for at least 24 to 48 hours. If you develop a headache, resting, hydrating, and pain relievers like ibuprofen can often provide relief, but it is important to contact your doctor if it is severe or persistent. A fascinating detail about post-lumbar puncture care is the role of caffeine. It is often encouraged because caffeine can help constrict blood vessels in the brain, which can alleviate or prevent headaches caused by changes in intracranial pressure after the procedure. This simple tip, combined with proper hydration, is a powerful tool in managing your recovery. Knowing these proactive steps can truly make a difference in your comfort. Understanding these recovery guidelines and knowing how to manage potential side effects means you can approach a lumbar puncture with greater confidence. By following your healthcare team's advice, prioritizing rest and hydration, and avoiding strenuous activity, you are actively supporting your body's healing process for a smoother and faster return to your everyday routine.